If you're new to running or you've been running since you were a kid, your back should not hurt before, during, or after a run. I often talk to clients who tell me it's normal for them to have back pain from running. Let me assure you, it may be a common issue, but pain from running is not normal. Now, I'm not saying that you need immediate medical attention, but you shouldn't ignore or push through pain. Pain is a signal from your body that tells you something is wrong. And if you're having pain that lasts longer than 2 or 3 weeks, it's best to have someone help you resolve it, because it more than likely will not go away on its own. Don't wait until back pain is unbearable, because if you do, it's more than likely that you will have permanent damage. However, if you go and see a PT when the pain starts, it's far more likely that you will not have permanent damage and that everything that has happened so far is completely reversible. So let's talk about some of the causes of back pain in runners. And then I'm going to give you tips on how to address and not push through back pain. Here we go. 5 causes of lower back pain when running. And the first one we're going to talk about is hip instability. Your hips ideally should allow a full range of motion without restrictions. This means your hips should be able to flex, extend, internally rotate, abduct, adduct equally, and all without pain on both sides. Because this ensures that your hip joint will stay healthy. If you lose the ability to move through one of those ranges while you're running, your body will adapt. But over time, these adaptations can strain your back. Let's talk about that. So for instance, let's say that you have difficulty lifting your knee to your chest or even getting it to 90 degrees. Then you go run. You will either have to limit how high your knee comes off the ground, or your hips will have to tuck under. Or let's say you have limited hip extension. Then every time you advance your leg, then your lower back is going to have to extend or arch to give the range of motion you need to propel yourself forward. And both of these adaptations add stress to your back that are not typically that will then typically lead to pain. So, number 2, trunk stability. So unlike your hips that need to be very flexible, your trunk needs to be very stable or stiff. While doing all the things in life, your trunk is supposed to be able to resist all motions, such as rotation, bending, and twisting. Think about how weird it would be if you could not sit in a chair without slumping forward or going to the side. Or if you walk down the street and every time you wanted to turn your head, your whole body would have to turn with you. Our ability to move as freely as we do is because our trunk has the ability to be stable. Okay, now how does that relate to running? When you run, you add additional forces to the mix. So compared to simply sitting, walking, and doing your other daily activities, your muscles have to then resist the impact of pushing yourself forward and landing on the ground. This adds additional stress to your upper back from your neck and your shoulders moving, and to your abdominal muscles as they try to stabilize your lower back and pelvis. So when your upper back or your abdominal muscles get too tired and they're no longer able to help hold the bones steady, you'll notice more side-to-side motion. You'll notice your shoulders slump or rotate more while you're running. And all of these motions, add stress to your spine, which will lead to back pain, all of that extra motion. So number 3 is posture. So ideal posture is created by maintaining a natural slight curve in the spine. Now, due to sitting and other aspects of our modern day life, we tend to have an increased curve in our upper back or our thoracic spine, and our shoulder blade area comes a little bit more forward, and in our lower back. By increasing the angle of those curves, we're inadvertently compressing one side of the bones in our spine more than the other side. So what I mean is if they stack this way, this way, and now we're gonna compress and we increase the angle, it's gonna be more on this side. And over time, that added stress on that one side can cause permanent changes, and an added stress over time is just gonna permanently affect the overall health of our lower back or that thoracic spine and even our cervical spine. The way the lower back starts to arch is normally from an anteriorly rotated, right? So if it arches, it's anteriorly rotated. And that happens from like tightening the lower back muscles or the hip flexors pulling it down in the front. Now in the thoracic spine, we typically get those changes from having our head forward, which causes the upper back to get stretched and weakened over time. So it's heavy holding our heads up over whatever we're doing in the day. So now if we take this back to running, if you start with a shortened joint space caused by the changes in our posture, and then you add all the forces and the impact that you get when you're trying to land, you're gonna further decrease that joint space. Now, depending on how far down that joint space gets, over time that can cause a muscle spasm, fractures, disc bulges. So it's not good. All right, so number 4 is muscle weakness. Now, since running is an endurance sport, we tend to forget that we need a balanced amount of strength to run with good mechanics. Strength is what allows the muscles the ability to continually absorb the impact when we're landing and then quickly propel us forward, which is the whole point of running, right? So, and running is a full body sport. Your upper back works to hold your shoulders up during arm swing. Your abdominal muscles are helping you breathe efficiently, and it helping keeping your pelvis stable, specifically while you're on one leg doing a single leg hop for as many times as you're doing as many miles as you're doing, right? Okay, it doesn't take but one muscle to be weaker in that system to kind of mess everything up because everything else has to adapt. So for example, if your hip flexor gets weak, then you have to change how you lift your knee because it hurts after a while. And one way people do that is by tilting their knee out a little bit, so you're not bringing it straight forward, you're bringing it out to the side because now you're using a different muscle. It's no longer your hip flexor. Unfortunately, that specific muscle also helps you control that side-to-side motion. So now that muscle has 2 jobs, which means it will fatigue very quickly. And that fatigue will cause you to shift left to right more often. And you may not notice the change in your running mechanics because it doesn't necessarily hurt when you're doing that and you've gotten rid of the pain while you're lifting your knee. However, it's harder for your pelvis and your abs to stabilize you as you're shifting side to side because it's such a bigger motion than it should be. And over time, that can harm your back. And there's one important thing I also want to note is that your hip flexor can get worn out because of overtraining or overrunning. So you really do need to make sure that you give yourself enough time to recover from each workout. All right, so number 5, poor shock absorption. Another reason for back pain. The moment your foot hits the ground, you're supposed to start absorbing the forces from impacting the ground. So proper shock absorption starts with your feet and then moves to the muscles in your legs and up into your hips and then eventually your lower back. So weakness or poor coordination in your feet and your hips typically can lead to harder impacts on the ground and send shock waves all the way up your leg and into your back. This repeated force aggravates muscles, joints, bones, everything in your spine, hips, knees, right? So it's very easy for this to be causing you a lot of pain while you're running. And so now let's get over what causes back pain, and now let's talk about the 7 things that help you stop lower back pain and get you back to running without limitations. The much more positive aspect of this, now that we know all the bad stuff. All right, so number 1, good running shoes. Make sure you're running with the correct equipment. For this sport, the shoes you wear are very important for reducing the stresses on your body. You need proper support and cushion depending on the surfaces you're running on, and depending on the number of miles you're going to run. So running shoes are designed to last for about 500 miles. If you're running 9 to 15 miles every week, then you probably need a pair about once a year. But if you're running closer to 20 miles a week, then you really should try to replace them about every 6 months. To find out more about proper shoe fit, please check out the other videos that I've done on this. I'll leave the links for you in the notes below. All right, so number 2, a warm up. So important. So when you're a kid and you go for a run, you don't get sore. Your body is so used to you ramping up quickly and then shutting down just as quick. Welcome to adulthood, unfortunately. Your body needs a little bit more of a transition period of time to get there. And just like when you want to put the music on and to get your mind ready to go run, you need about 5 or 10 minutes of warming up so that your body can get ready to run. And if you're looking for ideas on how to warm up for that run, I personally like active stretches, things like high knees, butt kicks, lateral lunges. And these can be done at a lower intensity than the run, but they use the same muscles. And by the time you get down to like 30 seconds to a minute of these exercises, your body is warmed up and you're prepared for that run. So once you get into the habit of warming up, your body will thank you. All right, so number 3, stretching. Stretching is like the medication everyone knows they should take, but they don't. After runs, I always suggest stretching. First, it's a great cool down activity. It prevents muscle soreness by improving all your recovery times. Woohoo! Not to mention, it helps keep your joints healthy all over your body. So, to cool down, my go-to stretches are passive stretches. So these things you would hold for like 30 seconds to a minute instead of moving through them. So hamstrings, hip flexors, quads, piriformis, calves, all the things you use while you're running. And stretching is vital for everyone, but especially runners. Stretching helps your muscles so that they can maintain the proper balance, and that helps you keep the joint space that you need so that you can have healthy joints for a long time. And any program that I create for runners, I always keep a special day just for stretching. And I would set it up for 15 to 20 minutes worth of stretching. And that way you get into the habit of taking that time. And it allows you some makeup time if, you might not have been able to stretch right after your run, which happens, life happens. But at least you have that dedicated time to actually stretch properly. Number 4, strengthening. Running is an endurance sport. However, it takes a lot of strength to maintain proper mechanics when you're running. Your whole body is challenged while you're running, which is what makes it such a great thing for your health and for your wellness. Now, I know that most runners have a hard time with the idea of not running for a day. However, all professional runners have a strengthening program, which tells me the importance of strength training. And so if it's good for the professionals, it's good for us. Taking time to strengthen your body with weights or at least body weight activities will not take away from your run. In fact, it only adds to your pace and your distance while improving that recovery time and reducing the risk of injuries. So exercises like lunges, squats, heel raises are the foundational movements for runners. Plyometrics, number 5. So back to being a kid. When you're 5 years old, you jump as part of your everyday life. As an adult, most of us do not have a daily reason to jump. So like everything else in life, jumping and landing is a skill that we lose over time and we need to practice. And plyometrics is a way to practice the skill of absorbing the impact when you're landing. To start plyometric training, I do jump ropes or just small little hops on the ground. And when you land, you should not hear a loud thud. And as you hit the ground, you shouldn't hear a thud. And you're trying to absorb that impact and reduce the stress on your back and your knees and your hips and everything else. And that's what plyometrics is about. All right, so number 6, ice and heating. So I would apply ice for 10 minutes. If that doesn't get rid of your symptoms, then you can apply heat. And whichever one helps your pain is the right one for you. But you shouldn't feel the need to constantly be icing and heating, putting heat on your body to make it through your day. If after applying the ice or heat, you really should have less or no pain for at least 30 minutes. And that tells you it was the right thing to be doing. Everybody gets sore after a workout. Running is a high intensity thing. And if you add strength training, you are more than likely going to be sore. So you just pick whichever one works best for you and keep going with that, because either ice or heat should really be able to make a big benefit for you. All right, the last one, number 7. See a physical therapist that specializes in runners. As a runner, if you've suffered with nagging back pain for more than 2 or 3 weeks, please see a physical therapist that specializes in runners, because they're going to be able to help you find the exact root cause. Why let that discomfort steal the joy of running and being active for any longer than necessary? There are various reasons for back pain while you're running. A physical therapist, especially one who helps active adults, should be able to work hands-on with you to find out the root cause of your pain and quickly help you eliminate it. So they'll be able to create a specialized program to fix your specific problem. And not only that, they're also there to help make your body so resilient it doesn't keep coming back. So if this is the type of care you're looking for in the Cypress, Texas area, and you're ready to get started, call us now or click the button below that says cost and availability. You'll fill out a quick form and we'll call you back to answer any questions that you may have and get you on the schedule. If you're a little unsure if this is the type of care that you're looking for, that you need, perhaps you're skeptical since that would be any different than the last person you worked with, or you simply have questions about your specific needs, then click the button below that'll say talk to a PT. We'll get you scheduled for a 20-minute conversation with me, and during that conversation you can ask me any questions about your specific concerns and your specific situation, and to make sure that we're a good fit before you ever have to commit to coming in. Now, I know this was a very long video, and I hope that this information was helpful and that you're having a great day.